So we're here with James Freilich and his parents, Dr. Richard Freilich and Nancy Figaro. So thank you so much for being here to speak with us today.
Our pleasure.
So just to start, James, could you tell us a bit about your epilepsy? So how old you were when you were first diagnosed?
I was 10 days old. Nobody knew what to call it, really. It was just called seizures. Nobody had a name for it. So it was a bit confusing at the time and scared my mother and father since I was so little, and I didn't really know what life really meant at that time. I didn't have much of a childhood. I was in and out of school, about 5 schools in 5 or 6 years.
Well, probably over about 12 years, because during your school years.
But I was in hospital most of the time, so that was my childhood.
And how old were you when you got an official diagnosis?
Well, he was, they just said he had seizures, and then when he was 3, we learned he had cortical dysplasia. Yes. We've never heard of the term. Yeah. Mm-hmm. We were told he had a brain tumor, that's what it looked like on the CT scan. Mm-hmm. Yeah. But they did at Sick Kids in 1991 when he was 3. Yeah.
And how frequent were your seizures?
As awful as 30 times a day.
And what type of seizures?
They're called, don't tell me.
No, I won't tell you.
They were, okay, tell me.
Well, he had at least 3 different types. He had what we call tonic-clonic seizures, or grand mals, I guess. He had focal partial.
Or like complex
partial
seizures.
And he had absent seizures.
Okay.
And he had 4 types. He had gelastic seizures as well. Yeah. Yeah. It was kind of odd because with each new medicine that we try, there seemed to be a correlation between trying a new medicine and a new type of seizure. Mm. Like when he tried clobazam, that was a horrible drug for him, and he started having a lot of absent seizures. Mm. Okay. The gelastic seizures, I don't know when they started, but it would be like he'd be watching nothing on TV, like he'd be just at home, and you'd swear he was watching a funny cartoon or something. He'd start this laughter, and there was no reason, and it was like he was watching a cartoon nobody else could see, and we were told those were gelastic seizures. And then he had seizures where he would just out of nowhere fall down. So do you remember wearing a helmet? He had to wear a helmet.
For 4 years.
It was at least 4 years. He had a helmet because he would just crash down, and he was bruised and bumped all over, and lucky you never broke teeth or broke limbs, but yeah.
And so you've touched on this a bit, but can you talk a bit about some of the medications that you've tried?
Yeah. I've tried Dilantin, didn't work. Phenobarb, I overdosed on and ended up in the hospital for about 5 days. What was the other one? It was, somebody help me. Tegretol gave me massive stomach aches, and it didn't work, even though my parents said it did.
Well, we felt it was the best of all the drugs that he had tried, but for him it was horrible. The stomach complications, and you ended up toxic maybe 14, 15 times. We'd have to rush him back to Sick Kids because your body just couldn't get rid of the drugs in your system.
And one of the side effects was vomiting.
Yeah.
And I think diarrhea also, which sounds gross, but it is one of the bad things about the drugs.
And what other, phenobarb was the first one, clobazam, Diamox, Epival, we did something with vitamin E, they thought maybe he was short in vitamin E. We tried valproic acid, we tried
and he also took Lamictal.
Lamictal was good. Lamictal was quite good. You didn't have upset stomach on that.
Okay, and how old were you when you had your first surgery, James, and what kind of surgery was it?
It was a left frontal lobe surgery. It was in 1991.
So you were 3.
Yeah. 3.
And you continued to have seizures?
Unfortunately, yeah.
So within a year of that, I remember all the dates. That was November 26, 1991.
2 in 98.
And then in 1992, he had the next one, like September 22nd, 1992. And with each one, we thought, this is it. This is going to be a new life for our son, because the seizures are going to stop with surgery. But
I knew it wouldn't stop because they didn't go deep enough. They didn't, while they couldn't go as deep as taking everything out, even though I wanted it. But I was still underage and I couldn't make the decision for myself. But Dr. What's his name? Valiente. Dr. Valiente. Brilliant guy. He thought just like me. And it wasn't their decision this time.
yeah, it wasn't our decision.
It was mine. They were against it. I was all for it. I had nothing to do. I had nothing to lose. At first, Dr. Valiente, I didn't know that he was going to talk about surgery. He was going to talk about VNS, which I knew was pointless, because there was nothing in this world that would have made me happier than one more surgery. Somehow I knew that I had to have that last one. I had to have it. There was no drug and no cure except surgery. I knew it. They didn't want to listen.
Well, he'd had 5 surgeries at that point. 91, 92, 2 in 98, 1 in 2006. And you were getting depressed, and we just thought, 5 haven't worked. Why is the 6th one going to work? Can we really risk him, being built up that, surgery's the answer, when it wasn't the other 5 times? But it wasn't our decision. He was an adult, and that was the first of the 6 surgeries that he was an adult for. So it was totally his decision, and we just had to pray and go with it. And Jamie was so confident that one more surgery would do it. And you should tell about what Dr. Valiente told you, the side effects, like the complications. He was very upfront. He was great. He just laid it all on the line.
Well, I remember exactly what I said to him. He said that I would lose my arm and hand,
The right one.
the right one, and he said I'd never get any movement back. I didn't believe that, but I didn't care. I hated who I was. I hated how people saw me as, and I wanted to make a difference, not just for myself, but the people who were most affected by my attitude and my look on life. I had no life. That's how I always thought.
And it was really a shock that first that Dr. Valiente was going to speak very directly, very immediately about surgery, but the confidence that James had to hear what the doctor had to say, and he just in an instant, I mean, you knew that that's what you wanted to do. Your mom and I weren't prepared for that.
We thought we were there to discuss VNS surgery,
Right.
which we didn't want that either, but it was like, he just said, no, the only thing that's going to work is complete removal of all the diseased tissue in your brain, taking out all the cortical dysplasia, which obviously in the other 5 surgeries, they couldn't take it all. And Dr. Valiente also asked you if you'd ever been awake for your surgeries.
No.
And he never
No.
had. And he said, you know, I want you to be awake for this one because I think he said something, the results will be better.
Right.
And that was very fearful for me as his mother also. I thought, what is I mean, he's an adult, but he's always your child. What is he going to see? What is he going to hear? What's he going to smell as his skull is sawed open? I mean, there were a lot of things that I just thought, yeah,
Well,
but he saw it as a very positive experience.
And that leads exactly into my
Yeah.
next question, which is
Yeah.
what was the actual procedure like for you?
Well, something that I've never seen before is my brain. And it was so awesome. And they asked me, they put a picture in front of me, and let's say it was a moon, and I would have to say a moon or a sun or I can't remember what cards they had, but basically they were poking around with the knife to see which part triggered my seizures, and it was awesome. I've never been happier at that time.
And now
Yeah.
what was the recovery process like for you? Obviously, it was not your first surgery, but was this
No.
one different?
But it was good. I liked the nurses. I didn't like the what's the date today?
Every day.
6 minutes. And I was like, geez, do I really have to answer this? And but other than that, the stay was great.
How long were you in the hospital?
I think it was about 2 weeks here, and then
14 days.
And then you went to Bridgepoint for rehab for his arm and his hand.
But when all this happened, if there's a way I could get out of that, this would be the way. Just the determination that I had, and I think I've always had, with knowing myself, knowing how I affect people around me. That's what made me want to change after the surgery. And I still get pissed off sometimes, but I was a lot worse before everything. And I want to know what you guys see that you didn't see before.
Well, I think James is at peace with himself now that he never was before, because when you're seizing every day, 8-10 times a day, you have no control in your life. You know, you don't know when a seizure is going to happen. You don't want to go out in public. You don't want to embarrass yourself. You don't want to be on a TTC bus when you have a seizure. That happened to him, you know. And you don't want people staring at you like you're, you know, what's wrong with you? Are you drunk? Are you whatever? So I think James has some confidence. Like he said, I was a ghost before. I mean, James didn't talk before.
Yeah.
So this is really a big change and a fabulous change. I mean, you've had other great changes too. Like he doesn't live with us anymore. We thought he would always have to live with us because you can't be seizing every day and be on your own. So you've got your own apartment. You're
Yeah.
working. He's got a job. He's working. How many hours did you work last week?
36, but that was luck.
That was like, yeah. So great positive changes for you. I mean, you know, you had this dream. He always had this dream of being seizure free, and you've made that dream, thank God, with you've had great doctors with Dr. Del Campo and Dr. Valiente, and that dream has come true. He had a second dream though, and that was that one day he would never have to have any medication, and
Only half of that came true.
only half it. So he's completely off the Tegretol, but the Lamictal, what did Dr. Del Campo said, you have to be on a little bit of something for life. He said it's that they know it's not safe to take someone who's, you know, had all these surgeries and sees most of his life to take him off medication. So, but even that, it's so much less. It's less than half the medication. At one point,
Really, it
he
is,
was
yeah.
on 3 drugs a day, 3 times a day, plus the emergency drug, and now he's down to just 1, and it's a low dose. But he just seems. What was your word? You said it was a rebirth. That's the word he said. He's been born again. It's like he's new on this earth because he had surgery, and the seizures have stopped.
I'm 4 years old, basically.
At this
Just a
point.
toddler.
At this point, yeah.
Oh, it has been so wonderful talking with you. James, is there any last words you have for people who might be considering having epilepsy surgery?
Words of wisdom, here we go. Don't be afraid to broaden your options, your horizons. If it means surgery, do not hold back, because if you do, you will regret it for the rest of your life. And you don't want to look back saying, oh, God, I should have done this, because then you'll bring up a bunch of other I should have done things. And I wanted to leave a mark on this planet, not asking, I should have done this, or could I have done that? That's nobody. That's not how anyone deserves to live. They deserve everything that they can have, even when nobody else sees it. And that's my 5 cents of wisdom.
Wonderful. Thank you so much, all of you, for coming. It's been a pleasure to talk to you.
Yes,
Our
thank you.
pleasure too. Thank you.